Hi, in this video I'd like to briefly talk about fetal heartbeat and then why a lot of patients, a lot of mothers experience a very low fetal heartbeat during their early pregnancies. Now the fetal heartbeat usually arises on week 6 of your pregnancy, and then fetal heartbeat surprisingly is extremely high. So a lot of patients, they get surprised or worried, why is the heartbeat so high? So usually we observe it to be 120 to 160 beats per minute. Now this is very healthy, very normal, and the heartbeat will only gradually decrease up to towards the development of the pregnancy. And then because of this, we can actually pinpoint the gestational age of the pregnancy just by looking at the heartbeat, if it is a healthy pregnancy. So usually the early days of pregnancy, week 5, week 6, when the heartbeat arises, it's actually quite high, and then it slowly drops, stabilizes into 80 to 90 heartbeats per minute. So the healthy range is 120 to 160, but some women experience lower than this range. If you are lower than this range, then there is a risk of a potential miscarriage. Though it is not a guarantee that will happen, the risk is quite high. And then let's discuss what's exactly causing this. Now the most common form here is that we suspect there is a presence of an immunological factor. This is affecting the development of the pregnancy. But we can assume that this anti-embryonic antibodies, which is the immunological factor, levels is not so high, but it is present and it is affecting the embryonic cells, the fetal cells, causing poor development. So usually if the levels are not too high, usually the heartbeat comes a bit later on. The healthy number is that we want to see during week 6 and week 7, but some patients, if they wait a week longer, week 8, week 9, the heartbeat possibly can come back. But usually we want you to get treatment at this time. Don't risk it. Second one is a hormonal imbalance, also known as corpus luteum insufficiency. We are talking about progesterone. Now this is also another treatable condition. If in fact is the cause causing the fetal heartbeat to appear later or much lower, this is a treatable condition. How we treat this is just by supplementing the amount of progesterone that you are lacking, not more, not less. Thirdly is a blood insufficiency one, which is quite common. Low heartbeat usually can be suspected to be caused by very low oxygen delivery to the pregnancy. When the fetus is receiving very little oxygen, the heartbeat may appear very late, or it may not even appear at all. And the underlying cause usually is the presence of a uterine malformation, the uterine septate, naive uterus. The implantation is happening on these, very close to these types of excess of connective tissues, very poor blood flow. So naturally the heartbeat might be underdeveloped or may not even fully develop at all. This type is also need to be treated, but can only be treated after the pregnancy. So certain cases we might need to advise for a termination of pregnancy. And then lastly, we will talk about genetic abnormality. Genetic abnormality is also another common one that we see during the first trimester, causing the heartbeat to not even arise at all, or very late, or even very slow. Genetic abnormality is something that cannot really be prevented. We need to look at the environment of the mother, internal environment, external environment. What we can control is the internal environment. For example, is there anything affecting the ovaries, the development of the follicles, fallopian tube, endometrium, and then also the external environment of the mother, for example, water that she drinks, is she exposed to any type of radiation, any type of medication that can affect the development of the embryo. All of this needs to be taken into account. And then we must fix what we can fix. But ideally, genetic abnormality is something that is very rare but hard to control at the same time. So I hope you've learned something in this video. Now, let's do a quick recap. The most common one is the immunological factor, which is the presence of an anti-embryonic antibody. This is treatable. Hormonal imbalance, lack of progesterone, also treatable. Thirdly is a uterine malformation, but it's treatable outside of the pregnancy, which means the pregnancy termination might be recommended, or sometimes we just need to be a bit patient. Wait 1 or 2 weeks again. Maybe the heartbeat will rise up, depending on the severity.